But I would like to start back to how this collaboration sort of came to be. And an article was published by Dahlia and a colleague of ours, Dr. Lydia Thurston, on breastfeeding and doula care in Jefferson County. And I was reading it and I was like, well, maybe I'll just shoot an email to them and see if they want to connect. And Dr. Thurston got back to me right away and set up, sort of put our heads together on what Dahlia has been leading for so long here in Alabama in terms of doula work and making doula work accessible, but also what our skills could all bring to the table to help move things forward. It became clear to me that this might be our opportunity to work on scaling up data collection for doulas, which based on previous experience, as I know, is important as the work becomes more nationally recognized and expanded and integrated into our maternity care teams.
So I have a degree in public health, and I came really from the biological sciences and research science. And so from the beginning, we have always been collecting data and storing it on this ridiculous Excel spreadsheet, right? That's what we had. And like Holly said, it's a huge challenge to just get people to submit data. But I've always wanted to have the data because I understand through my public health background how critical that is to make policy change. So when Holly said, let's find a way to make this work better, step it up to a more professional level and make it more accessible, I was all in. We didn't have time to really upgrade to a fancier system. We haven't had the people power, the bandwidth to do what needs to be done to get to a better level of data collection. So having this partnership has just been wonderful.
There are ways to balance this partnership where you are not burdening your community partners, but you are working with them to benefit them and to provide appropriate support and services in the ways that Dahlia described earlier. So really, as an anthropologist, it's hard for me to step away from the importance of the lived experience, but really making sure that you are understanding the reason in which you're interested in community engaged work and approaching it with a sense of humility and respect, and recognizing that the timeline and the process isn't going to necessarily look the exact same as if you were doing a non-community engaged academic grant. And really respecting and trusting that process, because the people on the ground doing the work, the community members, are the experts, and it's 100% rewarding to work and learn with them.